In May 2010, the World Health Organization agreed a resolution on viral hepatitis. The resolution called for a globally coordinated response to this deadly disease, covering vaccination, safe healthcare and injections, testing and treatment for patients, education and advocacy for those living with the disease, and research and support to help countries formulate their own national responses. A problem such as this in every country in the face of competing health priorities requires a champion. And I'm glad that in Bangladesh we have a champion for this cause in the Liver Foundation of Bangladesh. I applaud you, sir, for championing this cause. As part of the WHO commitment to education around hepatitis, today marks the first official WHO-supported World Hepatitis Day, which is being globally coordinated in partnership with the World Hepatitis Alliance, of which the Liver Foundation of Bangladesh is one of the first signing members. The day is being observed to bring focus on the need for specific actions globally and at the country level. Actions such as strengthening prevention, screening and control of viral hepatitis and its related diseases, increasing hepatitis B vaccine coverage and integration into national immunization programs, and coordinating a global response to hepatitis. As we all know by now, the hepatitis-associated viruses A, B, C, D, and E can cause acute and chronic infection and inflammation of the liver, leading to cirrhosis and liver cancer. It is estimated that viral hepatitis will kill over 5 million people in the Southeast Asia region of WHO in the next 10 years, and Bangladesh is a member of the Southeast Asia region of WHO. The disease has already killed more people than malaria, dengue, and HIV/AIDS virus put together in this region in the last 10 years. Viral hepatitis strikes people in their most productive years. Although 520 million people estimated globally and more than 130 million people in the region are hepatitis B and C carriers, awareness of this disease is low. And I believe this day, World Hepatitis Day, will help raise awareness among the public of the public health impact of the disease. The World Hepatitis Day provides an opportunity to recognize viral hepatitis as a major global public health problem. Hepatitis B and C viruses are known as silent killers, and people can live with the virus B immunization that has taken place through the National Immunization Program. And I think this will begin to address one of the concerns raised by the chairman of the Liver Foundation of Bangladesh about having a much better knowledge base about the prevalence of hepatitis B in the country, because this study will be doing a nationally representative sample, and it will be taking up markers for both hepatitis B and I think hepatitis C as well. So we have an opportunity here, and WHO is supporting this study both financially and technically. I'm glad to see the emphasis being placed in Bangladesh on preventive measures as well, and measures to raise awareness, because these are important. Countries need to make screening of all blood and blood products for hepatitis B and C mandatory. Governments should ensure that children are adequately immunized against hepatitis B. Healthcare workers and the public need to be educated on the risks. The surveillance system for hepatitis needs to be strengthened. So unless we act now to create greater awareness among policymakers, healthcare providers, and the public, I'm afraid viral hepatitis may remain a major public health threat.